South Africa's response to the coronavirus pandemic has been lauded. Officials have been praised for taking quick action to mitigate the spread in a country where comorbidities and economic conditions could have allowed the virus to thrive. But the focus on COVID-19 sometimes meant the neglect of other healthcare programs, including for those with TB, HIV and vaccinations. Professor Francois Venter is the head of Ezinja at Wits and joins us now. Professor Venter, good evening, and thank you for your time. One of the things that we've been hearing, especially from doctors who practice at the height of the HIV pandemic, said, well, COVID-19 was very reminiscent of that. You're one of those doctors. What was your experience?
So a lot of COVID felt like HIV fast-forwarded, all the stuff that we had to deal with. The only thing that was different was the government, at least scientifically, took it seriously at the front end. Unfortunately, it hasn't taken it seriously this time. It hasn't taken the HIV and the TB and our primary care program particularly seriously. We've almost pitted COVID against all the rest, all the other gains that we've made over the last 20 years. So we've seen a near collapse of the TB program. The HIV program has been set on its back foot. We've seen drug stockouts. The vaccine program is on its back foot. So we've done this terrible thing in this country where we've prioritized one disease over the other. So I'm quite dispirited, actually, because I think we could have done both. The debate's almost as if COVID's so important, we must let everybody else, every other disease is not important at all, to, it's only just the flu, why are we taking it so seriously? COVID is a very serious illness, make no mistake, but so is TB, so is HIV, so are all these vaccine things. These are not nice to haves, and unfortunately, we are going to be picking up the pieces of the collapse of those programs for the next couple of years to come.
When we look at the programs that you're talking about, I mean, many of them have been in existence for decades now, and the infrastructure around them, one would imagine, had been quite, progressive. So, has that all been obliterated within this period? And if it has, what has been the main reason for that?
No, it hasn't been obliterated, but it's been dealt a severe blow. So we've been making incremental gains in the HIV program for the last 20 years. We had the denialist dreadful phase. We had a more open phase. I mean, there have been a lot of operational issues around the HIV program, but it's really borne fruit. We've seen a dramatic improvement in life expectancy. People are living long and normal lives. And in the last few months, we've seen these programs severely disrupted. So they're going to need to get back. So if you're healthy HIV positive and you fall off your drugs for a little while, it's probably going to be okay. That is not the case if you have TB. If you have TB, you've got, and you're off treatment for more than a few weeks, or you don't get diagnosed in time, your chance of dying is very, very high. And with vaccines, we have to now mop up all those kids who didn't get their vaccines. We've already had measles outbreaks in this country. Now, we've got a whole generation of a whole year of children who didn't get their measles vaccines, who we're going to now have to go and mop up. So the population's at a lot of risk at the moment for a whole lot of other things that were going wrong long before COVID, that we should have paid more attention to preserving. As I said, this is not about COVID versus everything else. COVID is something serious. We needed to take it seriously. But we shouldn't have allowed these other programs to be as damaged as they were.
Of course, the other thing that we're looking at here is that when it comes to funding, I suppose, on a national level, to some extent, needed to be reprioritized. But there's important work that independent and NGO organizations do in giving to the work and to the fight against TB and HIV. What do you foresee as being the long-term impact of donors who now can no longer give as much as they used to, or who have to look at their own country's affairs as they too try and deal and recover from COVID-19?
So I am worried. I'm more worried about other African countries because they're completely dependent on donations. It's really just South Africa, Botswana, Namibia, who are actually fund their HIV programs and their TB programs and their health system off its own tax base. The donor support in South Africa is actually relatively small. But that's also very worrying, is that the economy has taken a massive knock, and the health department is going to be facing severe funding cuts going forward. So I'm very worried about maintaining these large programs that we've got, the vaccine programs, which consume a substantial proportion of our health budget, the ARV programs, which are also very expensive, as well as the rest of it. So this is a time of deep worry for anyone who's interested in health and in public health. for the next few years. So we're going to have to start setting other priorities. The COVID first wave is gone. I think we're still dealing with a staggering, a small number of cases still trickling through, and there's a real concern that we're going to see another wave to come. But the debate we need to be having now is how do we repair what we've got with the resources that we've got?